Dr. Gandhi, I just want to be clear here. You have written extensively about this, and you're clear that kids need school. We want kids to be in school. Painting this as a conversation about people who would like to have kids in school versus kids those who don't is silly. We'd all like our kids to go to school. We'd like them not to get coronavirus. We'd like them not to infect other kids and their families, and we'd like them not to die. But we would actually like them to get the socialization and education necessary from school.
That's exactly right. I mean, let's get that out of the way right now. Kids need to be in school. It is good for their social, mental, and developmental well-being. And the only reason that I'm here right now talking to you, and the only reason that physicians and public health professionals around the country are talking about this issue, is that we fail our children by failing to take the necessary steps to mitigate this pandemic. We have the solutions in front of us. We're just not taking them.
Dr. Gandhi, you do talk, though. I was just having a conversation with Cori Bush that you may have heard. Part of this is the way we're built. Part of this is that unlike any other developed nation, we don't have certain infrastructure in place. It's part of why in Travis County, you have so many cases of Hispanics getting coronavirus and dying. It's why Hidalgo County is in the trouble that it's in. We have almost developing country statistics in Hidalgo County in the most developed nation in the world.
That's exactly right. I mean, look, it's a tale of two cities here in Austin. When I go across town and work in East Austin, I work in a facility where roughly about 80% of my patients are likely Spanish speaking. And there are baseline inequities in health. If you are a Black or brown child in East Austin, you are probably 3 or 4 times likely to go to bed hungry. That poverty rate is equally as high for Black or brown children versus white children. And so when you superimpose on a pre-existing set of inequities, COVID, a pandemic, without having the kind of institutional support for these families, it's a disaster, and we're not taking the right steps.
You pointed out that this is not beyond us in terms of science. We can do a few things, including rapid testing at scale so we can contact trace, funding schools to ensure that they've got health resources, nurses, PPE, and proper ventilation, requiring everyone to wear masks and to social distance, which we're not doing across this country, and a national plan to determine what happens when clusters of students, teachers, or their families start testing positive. So we don't have this let's figure this out as we go along idea.
Right. I mean, look, this doesn't have to be a conversation in the abstract. We're doing it now, right? The NBA has been unbelievably successful at having no positive cases over the last few weeks with its players. And they're doing it, as Coach Rivers said, I think just 2 days ago, because they're all made to wear masks. 1, 2, they're getting tested every single day. And 3, they have an app that they sign into every day that says what their temperature is and their vital signs. And so if we can stand up that kind of system for the NBA, there's no reason why we can't stand up this same kind of system for school children and teachers around the country. But I'll tell you what the reason is. It's because school children don't have lobbyists. They don't have money behind them, and they don't have advocates in Washington, D.C. who are willing to fight for them, and it's simply not enough.